Hello, everyone. Good afternoon and a happy new year. So this is our first session in 2026, but in total, is our 11th session. Last year in 2025, we were able to, run 10 sessions of the Disaster and Emergency Management Lecture Series. And I'm very pleased that in New Year in 2026, we start another session in January. And hopefully we will able to continue running and hosting amazing lectures throughout the year in 2026 and later. So welcome all of you. And just as just a short reminder that this session is recorded and the recording will be available on our YouTube page and also our program page. So this is a session. In this session, we will discuss best practices for building resilient and psychological support for wildfire responses. Today, Dr. Laurie Pearce and Mr. John Hill kindly and generously accepted to share their recent research finding with us. Their findings are based on extensive literature review, the review of the more than 100 peer-reviewed articles and books, plus hands-on clinical experience from supporting responders to wildfire in Canada. However, before going any further in our session, like always, I would like to begin with a land acknowledgement. Right now, I'm sitting in my office at the campus of the Royal Roads University, and the Royal Roads University acknowledges that the campus is located on the traditional lands of the Lekwungen-speaking people and Songhees and Esquimalt nations. This land is a part of the fabric of the life of the Indigenous communities, and it is with gratitude that we live, that we work, learn, and sometimes play here. That being said, I would like to invite any of you to take a moment and reflect on the land you are residing and acknowledging that, unfortunately, colonialism is not an historical context. It is currently an ongoing process, and we need to build our mindfulness of our present participation. As I mentioned, I have today the pleasure of hosting Dr. Laurie Pearce, my colleague, my dear colleague here at Disaster and Emergency Management Program at Royal Roads University, and Mr. John Hill with combined career in firefighting and counseling as a clinical social worker. I'm pretty sure that Dr. Laurie Pearce is, most of you know her career, her legacy. But for those of you who know less about her, and for folks that we will listen to this lecture, the online and later, I would like to present Dr. Laurie Pearce. She is a recognized practitioner, educator, and researcher in the disaster emergency management community here in Canada. She provides consultation services for various federal and provincial governmental organizations. She was the research chair at the Justice Institute of the British Columbia, and her existing research is focused on the impact of the disaster on evacuated households, particularly those impacting Indigenous community. And also, as I mentioned, she is an associate faculty here at Royal Roads University. Mr. John Hill, thank you so much also, Mr. John Hill, for your participation. He has a keen understanding of the stressors and challenges of the fire responder career as he combines careers in firefighting, both wildfire and within the Metropolitan Fire Department setting, and counseling as a clinical social worker. Whether providing one-on-one counseling, supporting a fire crew, emergency operations centers, or assistant to a local field unit and their families, Mr. Hill utilized empirically based best practices to support and educate mental resilience through all stages of the disaster response. thank both of you for accepting the invitation and will generously present and share your research finding with us. Before letting you and to start your presentation and share your knowledge, I would like to remind our participants that your participation are very welcome, and you can participate in this session by either typing your question into the chat box, which I will make sure that you read it carefully and bring it up to our presenter and lecturers at the end of their lectures, or you may prefer to hold your thoughts and questions until the end of the presentation. Then you will be invited to unmute your microphone and ask your questions directly to our lecturers. If there's no question or, comment, I would like to invite, without further ado, I would like to invite our lecturer to start their presentation. Laurie and John, please go ahead and feel free to start your presentation.
Thanks so much, Robert. Yeah, I'm going to share my presentation, and hopefully everyone can see that.
Yes.
There we go. Great. So welcome, everyone. Delighted to see some very familiar names and some of my new students in the disaster management program. So we're going to just go over a little bit in terms of background. As Mahmoud mentioned, we looked at over 100 peer-reviewed investigative articles and books and some great literature as well. And our findings, what we looked and found in the research, we then took a look at contrasting that with what our experiences were in terms of the support for those wildland firefighters that we were providing both on the ground and virtually as well. And our recommendations are based on evidence and practical experience. So how this presentation is organized is we're going to look at what the literature told us, and then what we found. I'm going to present what the literature tells us, and then John is going to look at presenting what we found on the ground and in our conversations and discussions with wildland firefighters. So we using the wellness wheel as an eco-health approach and taking a look at those various elements on how each one of those impacted the wellness of firefighters. So the first one we're going to look at is occupational. So really that's about creating satisfaction with your work. So what we found out in the literature was a number of things. We found out that workplace stress was significant in wildland firefighters. It's a difficult environment. It's a challenging environment. Managers are frequently acting in positions and relationships are not always great. There's a lot of coming and going back and forth. And unfortunately, the nature of the job means exposure to traumatic events such as deaths of firefighters, wildland firefighters, or injuries as well. We found then the literature that when people felt that they were shown respect and recognition and their accomplishments were acknowledged, that made a lot of difference to how that was worked. And in wildland firefighters, management were often way off, like not even on site. They could be in Canada, hundreds of kilometers away from an operational center. And the literature was really clear that when management shows up on site, it makes a big difference. The psychosocial factors, not unexpectedly in terms of stress, the unsafe work conditions, etc., and discrimination. I'm going to talk a little bit more about for women, female firefighters, but also Indigenous, and there's some literature on that as well, not as much as I would like to have seen. And it was very clear in terms of literature of what incident commanders needed to have. And of those listed, being trustworthy was one of the ones that was the most critical in terms of making sure that people felt safe in the workplace, that you're being held, told to go into dangerous circumstances and situations. And so that was a really important factor. That the psychological injuries were 8% of injuries for males, and for females, 24% higher, like so 3 times higher than for men when you took a look at injuries. And these numbers here are based on the US. There's no reason to believe that they would be significantly different in Canada. I would hope not. But around sexual assault, 13, almost 14%, mostly females, reported unwanted sexual touching or assault. And here's what the numbers from the states indicated that were really of concern, especially, is that a third of them, basically 33%, were by a supervisor. Right. So those are really upsetting circumstances overall, but especially that it would be someone who that person, that firefighter should have been trusting, right? And the positive side of things is that healthy cultures can be learned, that training and experience makes a difference, humor is important, and that looking at developing resilience skills can help to negate some of those negative factors and prepare people for dealing with adverse reactions and can help out in the resilience skills both on the job but also away from the job. And then, John, give us a chance of what we found out.
So with the psychosocial supports, it's not universal across all agencies. What we have is, speaking to incident commanders, for some incidents, they're spending up to 50% of their time concerned with focusing on the mental health needs of their people rather than the mitigation of the disaster itself. As well, mental health professionals, as well-meaning as they are, responding to these kinds of incidents, many of them generally have a poor understanding of the wildfire culture and disaster response in general. And with that poor training, some of that is because the services are farmed out to EAP providers where they're hiring new mental health people who don't have the time into to really develop that area of expertise. So these are situations that can become very critical. People are losing their homes. They're unfortunately, people responding are losing their lives, and it can be quite intense. And you need people that have the experience and expertise to provide help. Traditionally, agencies are reactionary rather than proactive. They wait for a wildfire to happen and then they decide how they're going to respond to it. The same way with mental health incidents, whether it is what we would deem as a health issue, whether it is a accident on a scene, or whether it is inappropriate actions that are being done on a disaster site. So the other thing is that one of our responsibilities would be to see the performance of these people and to make sure that they are still operating at efficient levels. And agencies and individuals do not want to be called out on their limitations.
Thanks, John. So then the next one we looked at was intellectual, recognizing how to look at expanding people's knowledge and skills. And what the literature tells us in this case is that when we look at cognitive failures or errors that are done, that we see these taking a look at in various categories. And the literature told us that people were not paying attention, attending to things that were unimportant, developing that tunnel vision, or missing key things, that people were forgetting things, that people were leaving out steps of things that they normally would do. And the increase in those cognitive failures led to accidents and injuries. Literature also told us that post-traumatic stress disorder symptoms impacted the rate. So untreated post-traumatic stress disorder, for example. When that was in place, errors increased, unsafe behaviors increased, risk-taking and accidents. And that when wildland firefighters who had the ability to do so had an ability to control their workplace in terms of hours of work, how fast to move forward, when to take a break, that reduced the likelihood of both the symptoms and those cognitive failures, and basically led to a healthier and better place. And what we found out, John?
Well, mental health professionals can be trained to support emergency operations centers. And with any disaster or any wildfire, of course, you have an emergency operations center. And to be able to, the mental health professionals can detect these cognitive failures and identify them early to let people know whether or not, they've got sleep debt, their exhaustion, whether they've missed things. Unfortunately, the incident command structure that is used universally doesn't always promote job control, which Laurie identified earlier is something that is important to individuals. The other challenge, which Laurie also identified, is the instability or people enacting roles. So it makes it difficult for them to establish true leadership. And so the transient nature of the business, many wildfire fighters or even incident commanders are viewed as seasonal and replaceable. So agencies don't seem to want to invest in as much in retention strategies given the political environment. Everybody's saying, well, we don't know what the budgets are. We don't know what our ultimate bosses are saying. And unfortunately, for this type of work, there's too much reliance on the altruistic motivation of the individuals that are being hired by these agencies. You're doing this because it's important work, and just go out there and do it.
Thank you. So moving on to spiritual, that sense of purpose and meaningful. In terms of looking at the literature, there's not a lot focused on it, but it's important to separate religion from spirituality as well. They can be connected, of course, but it's more about the meaning and purpose and interconnectedness. And the literature was clear that there was a need for meaning and purpose, that also that those who were working in an environment that recognized that were happier, more ethical, more dedicated, enjoyed their jobs, absenteeism was reduced, and were really more committed. And so that was really linked in the literature to transformational leadership, where those who were in charge had a clear vision of things, were inspiring, connected individually with people, understood their needs, looked at how to better their work, respected them as individuals, and engaged in their promotions down the road, and increased a collaborative outcome and process. And that paid off in terms of job satisfaction and productivity. And what we found out, John?
Well, padres and ministers of different denominational faiths are very helpful and welcome. But there is a gap. There's a lack between religious and spiritual leaders having an understanding of what wildfire fighting actually is and being trauma trained. And so there needs to be more of that deliberate education and awareness. And as Laurie identified, recognition of Indigenous culture and spiritual practices is beneficial, not just to the Indigenous population, but to all firefighters. They are very receptive and are at times humbled by the support that can be given by the Indigenous leaders. Go ahead.
Yeah. And so the next one was just taking a look at the financial aspects of the work. Again, not a lot in the literature, but what we do know is that wildland firefighters experience different financial stressors than career firefighters. Most of them are seasonal. Most of them are hired in the spring and let go in the fall. The pay is low. Very low and in the low 20s dollars an hour range for many. And the salaries only become acceptable in a sense because of all the overtime that is put in. And working those long overtimes to compensate for the low pay reduces your ability to function when you're tired, when you're working all those long hours, and inhibits social interactions as well. That we know that the wildfire seasons are getting worse, that we are seeing an increase in number of wildfires and the intensity of those as a result of climate change. And as John mentioned, recruitment and retention is a critical aspect, and that work-life balance is important. And the literature is really very, very scarce on what happens when wildland firefighters also lose their home and lose parts of their own community. They feel guilt in having let down the community, but especially their families as well when they've lost their homes. And the financial issues with insurance, I can tell you the folks in Jasper who lost their homes, as in Kelowna, we've had this happen, but there's not much at all around what that means and how to manage that. And the economic responsibilities of insurance, et cetera, are then often left with a partner, and recovery is very slow, and they're still working and they're out and they're not there. And that has a big impact on people. We also know that women, female wildfire fighters were less likely to even have children than their counterparts because of financial considerations, because of the hours and lack of affordable childcare, and because most of them have to find additional work in the off season. If they find a good job, then they stick with it and they don't come back. And so that adds to the retention and recruitment issues as well, that you're constantly bringing in newer people that have to be trained. And what we found on the ground, John?
Well, as Laurie said, wages are too low, and very much so. As well, seasonal employment is less viable for many, except for students. And so what you get there is you aren't building experience, you aren't building expertise, because people can't afford to stay in the wildfire service for lifetime careers. As well, the liability is too great. We're getting people pushed to the limits. Cognitive failure is occurring. People, unfortunately, have lost their lives in everything from helicopter accidents to falling asleep at the wheel after being deployed to, of course, falling tree injuries. So with those liabilities, employees want more than a wage. They need benefit packages. They need the things that every basic person needs to live. And so that's not necessarily happening with these seasonal employees. So unfortunately, with their dedication and with their financial needs, wildland firefighters seek further deployment to make more money when the fires are there. So even if they're physically or mentally depleted, they're going out on more deployments. And of course, this has a ripple effect with their families because they have to be away from everybody longer. So it has a great impact. Go ahead, Laurie.
So then the emotional aspect of it, looking at dealing with all of those factors in terms of relationships, et cetera, this was where most of the literature was focused. And there were a number of important things. One was the impact of post-traumatic stress injuries. As you could expect, the impacts are all those things. Sleep impacts on relationships, burnout, physical illnesses, disabilities, and early mortality. We'll talk a little more about that as it relates to physical as well. And the outcomes now, these factors are coming mostly from a master's thesis. So those who are students right now, take a note. These things make a difference, by Alex Lane published on late 2024. And it's based on BC, for those of you who are in BC, on the Wildland Fire Service during the 2023, which was a big fire season with a lot of serious fires. And take a look at what some of those outcomes were. These were identified using standardized text. I'm going to talk a little bit more about that high suicide rate, 34% high suicide risk. But all of those factors were there in that population. And you take a look at what that looks like. The long hours, caffeine use, surprised to find firefighters using tobacco, some of it chewing tobacco as well. But when we take a look at the high suicide risk, 34% met the criteria for high suicide risk. For those of you who are into stats, SBQR score was greater than 7. 57% thought about or attempted it at least once. 37% had ideation at least once in the past year. 23% expressed to someone a plan, and a third basically at risk of future suicide attempts. That's huge. That's a really high factor that I think is really ignored. There's a separate growing threat to emotional health because these firefighters are often deployed away from home for days, sometimes weeks at a time, and they're separated from their families while they're undergoing all this emotional stress. And we think as the wildfires are growing in intensity, the literature says it's going to make it even more difficult for people as the fire season is being extended as well. And asking for help is difficult. It's difficult for everyone, but especially for those in sort of paramilitary organizations, wildland firefighting. And so the literature is clear that if you integrate that mental health support within those responder units and bring the support straight to them on a regular basis, that normalizes it and makes it more accessible. Interesting, on the road to mental readiness training programs, there was a lot of literature around it. And what we found was that as the literature progressed and started to take a look from moving from short-term impacts to long-term impacts, there were some short-lived small improvements in stigma following it, but no statistically significant improvements in mental health over the long term. And so these programs are really being pushed and promoted. And when you look at the literature, it's going like, whoa, maybe they're not really all that helpful. And so more research is really needed, especially for those who are already exhibiting some of the stress symptoms. Mindfulness training, however, the literature says is an effective tool, and it's quite positively linked to improved mental health in even just 4 2-hour sessions over a period of time. Guarding minds at work. This was interesting. This is a national standard in literature for Canada for the health and safety in the workplace for the wildland firefighters. And there's nothing to demonstrate in the literature that we could find anything that says that this is helpful. There's no evidence of it. And even though it's designed to educate them, there's absolutely nothing in the literature that justifies anything or is evidence based on it. What we do know from the literature is that peer support programs do work well, but they need to be well implemented. And there's a small, potentially important benefit, but you need to build these in at the start. That means training, peer teams for defusings, and how to participate along with mental health practitioners in critical incident stress debriefing, CISD, and to provide psychological first aid. And the body keeps score, well known in the literature that exercise, meditation, yoga, sports, time spent in greenery outdoors, those are really super helpful for anybody, but especially for wildland firefighters. And there are some blind spots. Wildland fire response dispatchers are not included in the literature for the most part and in the programs. But one study found, this US-based, that they also had a lot of indicators that they're sending people out into dangerous circumstances and dangerous situations. And so taking a look at what that how that translates into those factors is also important, and that Indigenous wildland firefighters had an even higher suicide risk. And so we really need to take a look at what those factors are and how crucial it is and target that prevention. And then what we found, John?
Well, employees suffer from organizational betrayal. And what I mean by that is that these wildland firefighters are asked to do absolutely the most difficult jobs possible. They are personally asked to be pushed to the limits of their ability to function. Their lives are put on the line. And so with that, there is a relationship. And in that relationship, they need to be provided with training. They need to be provided with the proper equipment. And when you are out there and you're doing these things, you aren't going to get through it unscathed. So when there are physical impacts, you're injured. When there are psychological impacts, which are also injuries, they need to have your back. And quite frankly, in most situations, they do not. So that's a betrayal. The addictive nature of the work is not explained. It is no mistake who goes into this line of work. They're in it, and they're certainly getting many, many positive things out of it. And part of that is the adrenaline rush, the dopamine. And there is not a lot of discussion on what happens after you've had this great high for a season, and then all of a sudden your season is over and you're left in withdrawal. It's critical to take into the account of the impacts on family, because no individual goes out there without support. And the better the support they have, the better they function and the better their resilience. But we have to look at what that dynamic is when those people are absent, and what it does to their families. And it is significant. So when it's time for them to step back, when they have reached their human limits, it's perceived as a sign of weakness, but it's not. And it's better for a person to identify before they reach the limits or break them, to be able to say, hey, I need to be rotated out. And this is not a safe or common discussion within the fire service. Retention is a real problem. When I was first approached about developing programs for certain agencies, they said, well, one of the things is retention. And I said, retention is really easy. Be the employer of choice. Just do the right thing. But they're developed their programs, and all of their attention is on the stuff, the helicopters, the water pumps, the hose, the axes, the packs, the turnout gear, and not the investment in the individual themselves. And that's chronic through the entire fire service. So that does need to change. Managers and human resources often have limited skills to manage the emotional context of what is going out, what it means to go out and respond to wildfire mitigation. And then at many times, you can have up to 800 individuals responding to an incident, and yet there's no HR representation there. And these are people that are being pushed to their limits. If there's going to be poor behavior, or there are going to be issues that arise, that's when it's going to happen. And people want explanations. If they lose their homes, as Laurie identified earlier, well, part of that is an HR problem. That's not a fire mitigation problem. So national and provincial offices, as we said before, they have a significant disconnect from frontline individuals, whether it's at a provincial or a federal level. It's hard to be calling the shots or hard to be considering what needs to be identified when you are thousands of kilometers away. So the last thing I want to reiterate is agencies really need to have the backs of their employees. If they don't feel they're being supported, they're going to leave, and that's what is happening within the fire service. Many go from different agencies, and they go to the agency that is the best one at the time. But that does not build in a lot of wisdom. It does not build in experience, and that needs to change. Laurie?
So then taking a look at the social factors in terms of that connection with developing that connection. What the literature tells us is that there are benefits of having those emotional and social supports from family, friends, coworkers, and they are protective for them, and that their engagement can lessen their symptoms. We also know that the partners, mostly female, but in some cases male, that there is significant stress as a result of their partner's absence, 78%, that when they are home, they're still involved in work type activities, and there's a lot of anger or frustration about what they're doing. Often they're still working because they're needing the money, so they'll be back from the fire but working somewhere else, and they feel often secondary to the job. And those who were permanent or full-time employees, they were straight, white, male, and or worked at higher pay levels, often had higher more positive work-life balance as to those who were seasonal, temporary, who belonged to the two-spirited LGBTQ 1+, non-white, female, or worked at lower pay levels. And using the literature from the US, Australia, and Canada, there was indications of increased intimate partner violence, especially when there was financial instability and where people lost their homes. We saw increased alcohol consumption and substance misuse, often feeling guilt that people had left their community down. And what we found out, John?
So what we found out was that in-person training and team building is critical. And unfortunately, after COVID, the norm, of course, is, as we are experiencing right now, Zoom or any other media platform for meetings. But for these people, they really benefit from in-person training, getting to know people, because this is going to be very, very high stressful work. Management teams and crew connection is important after the fire season too. What you don't want is people out there literally risking their lives for months at a time, and then they feel abandoned by their employer. They're having chemical letdown, and in many cases they can feel very lost, rejected. So there needs to be continuity, active connection within the entire year. As Laurie pointed out, there is little, if any, support for family members, and this is a very, very complicated issue. There's certain personality types that go into wildfire mitigation. You come into a situation where you have chaos and you bring order. Well, if somebody has done that all season at home and they're exhausted, and what you do is you come back and you think it's chaos and you bring order, well, what you're saying is you didn't do a good enough job, and many families go through divorce within the wildfire community, and it's almost rare. Oh yeah, my partner's in the business, so they understand. That seems to be the best type of couple that can survive this rather than thrive through this. So there are loyalty conflicts, and we've seen this a few times because communities themselves are being threatened now. We've had that in Jasper, we've had that in West Kelowna, we've had that in several communities in BC, and it's very hard to be loyal to your agency at the same time that your family needs you. And this is not going to be a one-off situation. This is more of the norm. So we need to have some sort of a system in place that is going to support these people so that they can do their work and support their families. So there's also no organizational discussion on the impacts of trauma bonding. And I've said that certain personality types gravitate to first responder work, certainly to wildfire work, and it is a person that is used to chaos. It is, and so people gravitate together, and they bond on this chaos, and they also bond on the fact that they were frontline together for seasons or this fire or that fire. That is both a positive and a negative, and it has impacts on their social connections outside of the fire service, and that needs to be discussed as well, and it certainly isn't being done. Laurie?
So then taking a look at the environment and the impacts of the environment, the literature, there's not much there. So the working environment's hot, smoky, you're looking at scenes of destruction and burned and everything. And we know that there's those kinds of things are linked to increased risks of post-traumatic stress disorder. And the only thing that we could find really in the literature was that bring photographs with you of greenery and the positive and family members that are experiencing joy and happiness. It was the only thing we could really find about the dealing with the improvement in terms of environment. And what we found out, John?
Well, what we found out was that the role of the information officer has taken on the role of the morale booster. And as well, in these economic times, it's ironic because information officers were one of the newer positions to join into emergency operations centers. They are critical on getting the information out there to communities and the public in general. But as budgets are being cut, the first people that are being reduced in these teams are the information officers. So this is a difficult trend. So information officers attempt to communicate the positive aspects of wildfire to the communities that are being impacted, just the general population. And so it's an important role. So yeah, they promote that through photo documentation, and that's important. But again, it's something that is put on the back seat. It's not seen as a priority, and yet certainly a priority would be a town hall meeting if your community was being jeopardized by a wildfire. So there is a negative aspect to wildfires, that they destroy everything and the economic cost. But fires can be viewed as black and destructive, but they're needed. I have a background in forestry first, and certainly the rejuvenation of wildfires is paramount to the overall health the forest and the environment. Laurie?
Yeah, our last one is taking a look at the physical aspects of it. And what the literature says is you got to be physically fit. So you need to basically make sure that you are reaching those thresholds pre-season in terms of fitness. That one of the best ways to do that without spending a lot of money is looking at hiking. And so encouraging wildland firefighters to be in the environment and to go hiking to get to that level of fitness. This was really scary information for me to read. This is based mostly on a lot of work that was done by, actually, the New York Times did two large investigative series of articles on this about the lack of wearing masks. And even though this is US based, we know that lots of Canadian wildfire fighters, even though they are given masks, it makes a huge difference. And when they don't wear them, they die young. Just very clearly. And they develop all kinds of cancers, COPD, cardiovascular diseases, and that even face respiratory masks with filters block about 99%. And N95 masks, many of us used to that from COVID, are also nearly as effective, but they're just generally not worn. And that crews do modify their work in terms of intensity to look at longer rest periods when there's heat. They are drinking enough water. These are all good things. Not drinking too much water either, which is a problem. Nutritional support needs to be overcome because you're out in the field in middle of nowhere. And so that has a challenge for people to fire camps. But rather than eating a single lunch, the literature tells us you're better off to spread the food into smaller portions across the day. But that often doesn't happen just because of the logistics of things and the recognition of that. That when you start firefighter shifts before 6 a.m., it's one of the most disruptive aspects to sleep. So just at least don't start before 6. And we know that risk of injury increases when the hours increase. And then, John, before we get to our quick recommendations.
Well, what we found is that there's no formal policy on wearing masks. And you would think that with the literature that Roy just shared, that would be something that would happen overnight, but that has not. And while crews and operational staff are extremely resilient and they can endure typical deployments, there's no formal mechanism to monitor them and to let people know when they're reaching their limits, when they are at risk of these cognitive failures or physical exhaustion. So there's also a lack of formal well-being check-in at the time of a deployment. And there, quite frankly, when you have, as I said before, up to 800 people on a deployment, I guarantee you there are some people that should not be there, as well-meaning as it is. And those are the people that are going to be taking resources away from others. So what we have learned is that on-site psychosocial support, if it's available, it's at the request of the incident commander rather than an automatic deployment. It hasn't evolved to that yet. So if you're the incident commander and you say, oh yes, I want mental health support on my team, that can be one of two things. You're either very progressive or they're going to deem me incompetent, that I can't handle my people. In the past, I could always support my people. It's far more complex than that. And they really need to have, agencies need to have that automatic buy-in right away. So psychosocial support at this point is a nice to have rather than a need to have. And it should be, both Laurie and I would like to see it as a need to have under occupational health and safety. There are just too many indicators that it should be there. And we hope that our efforts and this type of research that's ongoing are going to make the wildfire service safer and a better employer for these courageous people that we desperately need to support. Laurie?
John, we're just going to go through very quickly our few slides on our recommendations.
Sure.
So for wildland firefighters for themselves, wear their masks, at least the literature says, during the attack, sustained action, and prescribed fires, which are done before the regular fire to prevent them. Set your personal and professional limits. Stay physically fit and socially active in the off season. Stay in touch with your team off season so that you have that ongoing relationship. Nurture your family and relationships. Engage with your community. You're away for a time, important to connect back in terms of volunteers, coaching, etc. Take responsibility to actively recover. Use the time between deployments to regroup and refresh. Insist on getting that psychosocial, psychological support. Stay informed and advocate for yourself. And for organizations, John?
The organizations need to provide adequate time to decompress between deployments. There is a significant sleep debt that occurs to all people on deployment, and that is something that is really not being addressed appropriately. As well, identify and support peer CISM programs to be able to provide psychological first aid, diffusings, and assist in critical incident debriefings. They are very valuable, but as we pointed out before, they need to be trained well and be trained by very competent mental health people. So all agencies that do this type of work, they should consider on-site mental health support for deployments. I'd like to change that word from consider to have on-site mental health support. And obviously, there should be a review of policies to encourage recruitment and retention, and not at the cost of the individual. So I think that is paramount as well. We need to be able to provide more spiritual support and integrate Indigenous healing practices. It's so well received, and I think that there's much work that can be done there. So mental health initiatives to date have not noticeably reduced negative mental health. We're concerned about suicide risk, PTSD, depression, anxiety, and substance abuse. So yes, those of you that are in research, there's additional research needed. There's got to be better communication, and better access to the supports is really required. Yeah.
John, and so to our final slide here, what we know, the most effective strategies, this goes back to Hopfall, increase a sense of safety, calming, a sense of self and community efficacy, connectedness, and hope. So thank you for listening, and we have some time for questions, and hopefully we can come up with some answers for you as well.
Perfect. Thank you so much, Laurie and John. I enjoyed a lot. It's a very informative presentation, well structured, easy to follow. I learned a lot and I took notes. And if you have a time, I would be excited to ask a few questions. But I'm pretty sure that our audience, they have also questions that they would like to ask. So far, we have one comment and no question. Regarding the comment, Sarah mentioned in her comment that yearly this situation, the result that you found regarding firefighters, the situation in firefighter, she found some sort of the relevance in the army as well, in the force army, the situation as well. So this is interesting. Thank you so much, Sarah, for sharing that. And also, we have a question. Mike asked a question regarding which part of your findings struck you as most surprising.
I think, Laurie, if I can just start with the answer, I think both of us were absolutely shocked at the findings of the New York Times and the amount of cancers and how it is significantly shortening the life of firefighters, and that could simply be addressed in a big way by wearing N95 masks. You know, I'm a firefighter of 30 years, and when I started, I knew that there was some sort of a figure that statistically it shortened your life by 10 years. Well, now that I'm retired and a senior person, I want to take back every minute of those 10 years. So, you know, we're hiring people when they're in their youth, when they think they're invincible, and it's not going to happen to them. Their ego is fairly healthy, but I thought that was the most significant. What did you think, Laurie?
I agree with that too. I was horrified by the findings, but also what struck me was the high suicide risk, 33%. You know, that's incredible. And the rates of sexual assault also for female wildland firefighters, I found that to be quite horrific as well. So yeah, those were two things that stood out. Thanks for the question.
Perfect. Thank you so much. We have two more questions and one more hand raised. I will go first to the question wrote in our chat box. Jen mentioned this was extremely informative and well researched. Will you share your recommendation with BC Wildfire and other wildland fire services for implementation, I guess?
Yes. We made this presentation at the Building Community Resiliency with a few additional things here conference. And so there were members of BC Wildland firefighting who were there as well. Actually had a chance to speak to the assistant deputy minister for emergency management community resilience BC. So, and John and I are also going to be speaking, not the same presentation, but to the topic at upcoming FireSmart conference in Victoria in a couple of months. So we are trying to share these findings. Absolutely. Thank you.
Perfect. Amazing. So maybe we can go to Kyle. He has his hand raised. Kyle, could you please unmute yourself and ask a question or comment if you have?
Yes, thank you. Thank you for the presentation. So one of the things that I've noticed, my background is in wildfire. Just spent the season in Saskatchewan with First Nations groups, actually leading First Nations groups and being an A rep for them. One of the things that I've noticed, and I've had one guy successfully commit suicide now. I've had one that's attempted, but I'm wondering throughout your research if you guys have noticed a correlation between that seasonal work and not being able to find winter work that leads to a higher suicide rate.
We haven't looked at that specifically, but we are the literature and both of us from a firsthand experience know that there is a significant letdown and the mood and depression that wildfire fighters can experience is a real challenge. It's not being addressed at all by agencies, and that's one of the reasons that we talk about, you know, you need year-round support. And I think for Indigenous populations, that they come with a background where this would be even more critical to address because the despair, they might have a lot less to be going back to as well. And so that would need to be part of that. And I think that would be very fruitful research for sure. Laurie?
Yeah, thank you. There hasn't been anything specifically pulled out relating to it, but given that most wildland firefighters are seasonal employees, it's kind of buried into that, but it would be an important factor to look at. And as I mentioned earlier, there's an even increased higher risk than 33% for Indigenous wildland firefighters. So it really, really needs to be better explored and reviewed. So thank you for raising that, Kyle.
Mhm. Perfect. Thank you so much for your answers and for the question, Kyle. We have a question from James. He mentioned that that the question actually is regarding how to convince organization about the need of these changes. So his question is did any of your research look at implementing change? As you mentioned, agencies often react badly to having their shortcomings discussed, and in my experience, are loath to have to actually make changes. And in the next line, he mentioned to clarify his question, I think your recommendations are all good and resonate, but I just am wondering if you look at the ways to convince organization about the need to change.
Can I start on that one, Laurie?
Sure.
We mentioned need to and nice to. Any psychosocial support is only brought on board when it's perceived as a need to. So the convincing is done through, hi James. The convincing is done through cost benefit analysis. And if it's going to save them money, then they're going to do it. And if it's perceived as anything else, they're not going to do it. So that's my approach. That's the approach to put the wedge in the door, and then hopefully you can swing the door wide open on these things. I look at this as professional teams, and teams didn't have a lot of support 60 years ago, but then players got really expensive and the game got really expensive. And wildfire fighting is really, really expensive. And when you look at the price of a helicopter being, and I've seen quotes for some helicopters, $11,000, $14,000 an hour, 4-hour minimums for 2-week contracts, that's a lot of bucks. That's one helicopter where there could be 20 plus helicopters on one fire. They're looking at $1 million a day for some things. Mental health does not cost $1 million a day, but the cost of one well-trained person is invaluable. And people aren't backfilling. There's a lot of gaps right now. So the people that are still there, they are worth their weight in gold. Absolutely. Laurie?
I think one of the things that both John and I are looking at is translating these recommendations into policy. And so we're looking at further presentations to build on this in terms of hopefully providing some guidelines for policies to organizations to look at how to implement this, and then trying to get the word out through presentations like this as well, and trying to build on what is the research that is out there. There's some other researchers in Canada looking at this issue. So I think the key thing is to use these findings, advocate for oneself, and start to look at that cultural organizational change, which takes time, right? But it requires advocacy and speaking up. And we're going to try and do our best.
Amazing. Perfect. Thank you so much. So I'm cautious about the time. I know that we passed the time, but as the last comment that I will read from chat, but I will invite, if it's possible, I will invite our audience, the students, to contact you directly and ask their question directly, if it's possible for you, John and Laurie. But here I will read the last comment from chat, and in our chat box from Steve. I mentioned that it's extremely similar to the situation in paramedic services, and he said that we have found the peer support to be extremely beneficial. However, we have focused on diffusing and found that CISM model less ideal. When it comes to need for debriefing, we have brought in our psychologists as the cost benefit related to training the peer team to that level didn't make sense. Thank you so much, all of you, for your participation. As I mentioned, this session has been recorded, and recording will be shortly available on YouTube, and also the link will be available on the website, on the web page of Disaster and Emergency Management Program. Thank you again, Laurie and John, and I wish all of you a very great year ahead of you, and have a good afternoon. Take care.
Much, everyone. And please do feel free to reach out.
Yes, thank you. This was an honor to present this material to you. And it's important that we advocate for those that are doing the work. They need this. So thank you for attending.
Amazing. Thank you so much. Bye.
Bye-bye.
Everyone.